welcome again to Your Pet, Your Vet. We've got an exciting show for you today. Well, it's exciting to me, and I think you'll enjoy it too. One of the most common surgical procedures that we do in veterinary medicine is referred to as spaying. That's basically, the technical term for that is ovariohysterectomy. Same thing they do in people. It involves removing the ovaries and the uterus, hence the name ovariohysterectomy. And it really is a technical procedure, and it does require some expertise. Over the years, it's kind of been looked at as something that's just kind of done very simply and routinely, and I guess we've gotten where we can do it simply and routinely, but I really want to walk you through what's involved in an ovariohysterectomy. So we're going to start out with how we start with anesthesia, induce anesthesia, then we transfer them to the surgery ward. We'll show you the exact locations where we do this and the instruments that we use, and then we have a patient, and we're not going to be able to show an actual surgery this time, but someday we hope to do that when you're ready. But right now we're just going to show you the patient as she is recovering. Okay, well, here's where it all starts. We first start out making sure the pet is healthy. Obviously that's really important. We can't conduct an anesthetic or surgical event unless we know that. We give them a sedative, or we call a pre-med, which is basically just as the word explains, it's a sedative to help the pet relax. It also allows us not to have to use as much anesthetic, so there is a medical benefit to that as well. Here's where the sedated pet is brought to this prep table, we call it, and as you can see, it's set up with the anesthetic machine right here. This is what's going to have the gas anesthesia. We give a second medication into an IV catheter that's put into the pet's arm, and then that's the induction agent. And then once the pet is induced, that means is really relaxed and basically in a state of anesthesia, we will go ahead and intubate. This is usually what we use for different size tubes for different size pets. Or we may use a mask. This is another procedure. I personally prefer the tube because you get a much better seal, and it also protects the airways from saliva and other types of things that could potentially get into the windpipe and into the lungs. We don't want that, so this is really important. So we intubate all pets for this procedure. Then once we induce them, we hook them up to the anesthetic machine. This has oxygen being piped in, which is actually in the building, is actually in the floor, if you will, and it's piped in where we have it in here, and it's run through the anesthetic machine. It picks up the anesthetic in this what's called a vaporizer, and then the vaporizer is mixed with the oxygen and delivered to the pet, and then that induces anesthesia. Then we surgically prep the pet. In the case of a dog or cat, we're doing an ovariohysterectomy. We shave and clip the ventral abdomen, and then we use a surgical prep. And once we have the pet anesthetized and the surgical prep done, we transfer them to the surgery room where we'll go next. All right, here we are in the surgery room now. So we've transported the pet here to the surgery room. This is a heated table. This is actually heated because one of the main complications of surgery is hypothermia. That's low body temperature. So we bring them here, the anesthetic machine, we hook them up here. Again, we have the oxygen and the exhaust system here, so we can take out the exhaled CO2 and the gases that need to be taken away. And then there's the vaporizer over there, so everything's all set up to maintain anesthesia. Here's our monitoring equipment right here. I think we refer this to a previous show. This is how we can keep up with their blood pressure, their pulse ox, or what their oxygen levels are, their respiration, their CO2. We hook it up so we make sure everything's going well during the surgery. And here is our surgical tools. This is what we actually use to spay and neuter, spay particularly. As you can see, there's quite a few instruments here that are necessary. Everything from what we call thumb forceps, which is what these are. This right here is a hemostat, which is very important. Of course, everybody wants to know about the scalpel. There's the famous scalpel right there. Of course, it has a blade on there, sterile blade. Everything is done in a sterile procedure, and that's really, really important, or you would have a lot of problems with infection. So this is the setup, and there are cases where we need to, or clients will request using our laser machine. This is where we do laser surgery. I'm sure you're familiar with that. The difference in laser is that instead of using a steel, which is what a scalpel is made from, you use laser as your cutting device. And that is, you get better healing, less pain, and less bleeding when you do that. Also, on occasion, we have to use what's electrocautery. This is a device we use to control hemorrhage, particularly for more serious surgeries that may involve bleeding concerns. So we will also use this device as well. So the purpose of this show is to explain that a spay is truly a surgical procedure, an event that, you know, we may make it look easy, but it does involve quite a bit of equipment, quite a bit of expertise, and the end result, though, when you do it right, you rarely have complications and you have a healthy pet and a happy client. Here is Dixie. Dixie has just finished having surgery this morning. As you can see, she's resting comfortably here on what we call the recovery cot. She is a pit bull. Now, Dixie was actually in heat, which means she was in her heat cycle, or estrus, which a lot of people are under the misperception you can't spay a dog when they're in heat. Well, actually you can, but it's more involved. The reason why it's more involved, there's more blood supply to the reproductive organs, and it takes more time and expense. And it just requires more care. It certainly can be done. Not ideal, but a lot of times that's when people want to take care of the problem, because when they're in heat is when they have the bleeding and they attract the male dogs. So we certainly understand a lot of times this is when we have to do it. But Dixie did very good with surgery. She's resting comfortably. She had some pain management, and we will send her home with some pain pills so she has a nice recovery. And then we'll see her in about 10 to 14 days to remove her sutures. And as you can see, she's resting comfortably. And then she'll go home in just an hour or two.